I'm very excited to be joining Salina Women's Clinic at Salina Regional Health Center. I'm Emily Budden, an OBGYN.
Well, doctor, thank you so much for coming on the show, and welcome back to Salina. Why don't you tell the viewers a little bit about yourself?
My name is Dr. Emily Budden. I'm one of the new gynecologists at Salina Women's Clinic. I grew up here in Salina. My family moved to Salina when I was very, very little because my dad became a doctor here at the residency clinic. And so that's kind of what brought my family here. Growing up, I was really involved in a lot of sports activities and did things like the community theater, and really just found that this community was kind of the perfect place to grow up. I have a lot of idyllic memories about my childhood. After growing up here, I went to K-State for undergrad and then KU for med school, and then adventured off to Arizona for a short time. But after my husband and I had 2 kids, we decided that we kind of wanted to bring them home and give them a childhood very similarly to what we both had growing up, and I think Salina is the perfect place for that.
So when did you know you wanted to be a doctor, and was it always looking at OB-GYN?
So growing up from a very young age, I always knew that I wanted to follow in my father's footsteps and be some type of doctor, physician. If you would have asked me whether I would have landed into OBGYN, I would have said no, because I thought that OBGYN was just delivering babies. And while that is a very big part of the job, I like to see women as the whole picture, and I like to take care of them throughout their entire lifetime.
I think being a fairly young and a fairly new physician, you probably offer a good perspective to some new patients. Why don't you talk about taking a new patient through the practice?
Yes, I think that a lot of times when people are going to the doctor, it can be very scary and very intimidating, and that is especially true when women are dealing with GYN or obstetric problems like infertility or miscarriage or heavy bleeding or chronic pelvic pain. And I think that oftentimes women or patients are experiencing this type of thing alone. They might be telling a trusted partner, family member, or friend, but I have a lot of people who I'm the first person that they tell that this problem has even been affecting them for a very long time. And so I think that it's important for patients to feel heard at the end of the day, and I like hearing them, validating their experience, and we might not fix this problem that's been bothering them in this visit, but together we're going to make one decision to get closer to our goal.
Well, thank you so much for coming on the show, and welcome back to Salina, and thank you for watching. For more information, visit salinawomensclinic.com and like them on Facebook.